Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Governor of Ekiti State, Kayode Fayemi, stresses the importance of digitizing the office space this pandemic for more effective online communication. Yobe State government says isolation centers are not open because there are no patients to keep in them. And Dubai introduces new protocols for safety during 6-month-long Expo exhibition. Thank you for joining us. The Nigeria Center for Disease Control, NCDC, is calling for vigilance and adherence to the safety regulations of COVID-19 as students return to school. According to the agency, Nigerians must take responsibility to reduce the risk of spread among school children and staff by encouraging children to wash their hands frequently, report when feeling sick, and adhere to other safety protocols. The agency has reported more cases last night of COVID-19 while the country continues to record daily fatalities from the disease. Here's more on the pandemic updates.
422 additional persons in Nigeria have tested positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT, indicating an increase from figures reported earlier. Rivers accounted for the highest number of cases with 178 infections, Kwara had 87, FCT 57, Borno 20, Kaduna 17, Plateau 14, while Katsina registered 12 cases. Delta, Edo, Jigawa registered 6 cases each, while Anambra, Ekiti, Oyo, Ogun, and Nasarawa logged a single-digit infection. The total confirmed cases in Nigeria now stands at 249,154. The report also includes a backlog of confirmed cases from Bauchi and Delta states, as well as 0 cases from Abia, Sokoto, and Zamfara states. 716 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 220,195. There was 1 additional death in the last 24 hours, raising the fatality toll to 3,086. Currently, there are over 25,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. With over 16,000 samples, Lagos State accounts for the highest number of cases on admission, followed by the FCT and Delta State. Almost 10% of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while 4.3% of the population have been fully vaccinated. The total global confirmed cases have surpassed 313 million, while deaths are now beyond 5.5 million.
The governor of Ekiti State has harped on the need for the state civil service to embrace the revolution of working smart with the new normal necessitated by COVID-19 and other developments. The governor, at a meeting with senior civil servants, directs the head of service to entrench digital revolution to ensure reduction in physical contact in the line of duty.
Let me stress that point about working smart. Our leadership in the civil service and in the public service in general must look at this area, and we also must work with you, particularly in providing the necessary tools for you to be able to work virtually and work smartly, because that is where the service is going. It's not bricks and mortar. Yes, we will keep building and renovating and providing furniture and doing everything that will enable you to do your work from offices. But one thing that COVID has done for all of us, we've held Expo now for 2 years, if not more. And we hardly miss Expo any week. And we've done it virtually. Maybe we've had 2 or 3 Expo meetings physically, and there's a lot more that can be done with digitization of your records.
And over to Yobe State, where the government has clarified why its 5 isolation centers have been under lock and key for the past few months. The Commissioner for Health in the state, Dr. Lau Ngana, explains that despite the regular testing at its laboratories, Yobe has remained one of the states with the least record of the disease. He also reveals more vaccination centers have been established in public places and rural areas so as to curb the spread of the pandemic. But the state government is pledging to open the centers whenever they have patients. In the past 1 month, the record of COVID-19 updates in the state have been stable, with over 500 confirmed cases, 9 deaths, and 3 on admission.
You can't open an isolation center if you don't have a patient, you know. So it is not under lock and key to the extent that you have forgotten about it. The key is not thrown away. Once there is a patient, of course, if there is need to open it, we'll open it. Currently, we have also we have established 3 additional isolation centers in Potiskum, Keshwa, and Gaidam. The one here in Damatru, which is the largest one, about 200 bed capacity, the construction is ongoing. Those that are existing, they are prepared to receive any person that meets the criteria for admission in the isolation center. Locally, for us, we don't have that. Mass vaccination is going on. His Excellency, the Deputy Governor of the state, Honorable Idibade Gobana Waziri Mfone, received his own booster dose, and Executive Council members also received their booster doses. You know, vaccination is ongoing, and the whole reason is that we don't want the isolation centers to be occupied.
Communication and more communication is at the heart of the COVID-19 response in the country. This is according to Dr. Rejoice Lukalao, the Incident Manager for Emergency Operations Center with the NCDC. She said the country at the dawn of the pandemic deployed resources, risk communication teams to each of the states, which activated the emergency operations centers, followed by the molecular testing diagnostic centers. She believes that the pandemic is a marathon and not a sprint, and she's looking for a time when states take full ownership to curb the spread.
Between February to May 2020, all the 36 states had actually recorded at least a case. And so immediately we had an activation of our incident management structure. And so with that, every other state we had established a public health emergency operations center across all the 36 states and the FCT, and each of these states had their IMS, which is the incident management system, which is a structure that we use in responding to outbreak in the country. And so being able to establish our EOCs to respond to the outbreak at various sub-national level, and the fact that our IMS system were activated at those public health emergency operation centers, they've been up and doing and have been responding to the COVID-19 till date, from the time they had the first case till now. And they still have their regular EOC meetings. To an extent, yes, I am satisfied with what they are doing, but there is need for more improvement.
Well, let's talk some more about the 4th wave in Nigeria and what we're experiencing around the world. Joining us is Christian Happy, a professor of molecular biology and genomics in the Department of Biological Sciences, also director of African Center of Excellence for Genomics of Infectious Diseases, both at the Redeemers University. He joins us virtually. Thank you for joining us on the program.
Thank you.
What do you make of the Omicron variant, and really how the world is responding to the rise in cases?
Well, as you said before, we all know that Omicron is more contagious. We all knew, and then the world is aware of the fact that Omicron actually transmits more than other variants. So, and as such, we should, as we said before on this forum or platform, we should continue to wear our mask, continue to make sure that we respect social distancing. And even those that are vaccinated, we said it before, we should continue, to do as if we were not vaccinated. I think we are lowering our guard because some people believe that because they are vaccinated, then they are actually completely protected against the virus. This is a new variant that is actually transmitting faster. We've seen this all over the world. It's not a case peculiar to Nigeria, and as such, we should continue to keep to what we call the safety measures given by NCDC and other global health organizations. So it is a fact that Omicron is more transmissible, and we should be very careful about it.
Professor Happy, it also seems as if it's, another day, another variant. We're hearing about IHU in France and then also Deltacron. What can you tell us about the two?
I think these are exaggerations. For the IHU, it is basically the same person in France that is seeking for attention. So we all know that, and that's the reason why WHO already just said, well, this is not something that we should be taking seriously. And then the Deltacron is actually, again, people are really using COVID as a way to seek attention. There's nothing like Deltacron. There is nothing like, and IHU is just a mere, what I'll call fabrication, because there's no real evidence of the IHU strain and then saying that it came from somewhere. And then this was found only in about 12 cases. And it's really not a completely new lineage or new variant, the way, this is done. Classification of variant, it has a standard. And the IHU thing did not follow any standard. Imagine somebody naming a variant after himself. So that really shows you that this is basically someone seeking attention. And we really should be focusing on what is important. What is important today is Delta, and what is important is Omicron. So we should really be focusing on all those variants and then do the needful. Let's get vaccinated. Let's make sure that we respect, the social distancing and wearing our mask and avoid large gatherings. It is because of these large gatherings that we're really seeing all these increase in cases. And we should be more careful about all of those.
But there are possibilities that the virus can also mutate and then that it might be another variant of concern. And this is after Omicron, isn't it?
Of course there is. And we've said it before. As long as there's transmission occurring and transmission of the virus, that is the virus passing from one person to the other, there is that possibility that there is a new variant that could emerge. We are not saying that that is not possible. And that's the reason why we're encouraging people that this pandemic, can be ended by us. If we all do the right thing, we can end this pandemic easily. So let's wear our masks, let's get vaccinated, and let's reduce our large gatherings and then respect social distancing. We can all do it together. It's not the business of government alone or the government or international health organization. Each and every one of us should be concerned.
Professor, what's your take on some experts who feel that the string of new studies which confirm the sort of silver lining of the Omicron variant with the record cases but less hospitalizations, they feel that perhaps we're moving to a less worrying chapter at the beginning of the end of the pandemic?
Well, I think, it can be explained. The fact that Omicron is actually is giving us less severe clinical cases can be explained. We have had several exposure to several variants. Remember, we started with Alpha, then we have Beta, we have Delta, we have Gamma. All of those variants, exposure to all of those variants have helped to build some level of immunity. So not surprising that we're having a situation whereby we're having this new variant, but these variants, we are presented with much more milder cases. But let's not make any mistake. This same variant that we are considering mild today can change and become more severe. So, and as such, we have to be very careful. This does not mean and does not translate that to the end of the pandemic. If we continue to, not to do this, do the right thing, that if you continue not to be wearing a mask, if you continue not to be respecting social distancing, if you continue to have large gatherings, we will transmission will continue, and transmission continue. There is a possibility of emergence of a variant that is actually worse than Omicron. That's the reason why we're asking people, to do the right thing and get vaccinated, because that's very important in order to cut down this pandemic.
We always appreciate your time on the program. Christian Happy, Professor of Molecular Biology and Genomics, Department Biological Sciences with Redeemers University. Thank you for joining us today.
Thank you.
Well, we have more from around the world on the COVID-19 pandemic. Please stay with us. Welcome back. The United Arab Emirates today announced remote learning will continue for schools till January the 21st, one of the new measures put in place to curb the fast-spreading Omicron variant. This announcement comes as local authority records over 2,000 new cases of infections and 982 recoveries and 4 deaths. Meanwhile, organizers of the expo in Dubai appear to be on track for the final 3 months of the exhibition as they put in place measures to curb any spread on site. Our correspondent Maiwa Diguke has more on the situation at the expo.
Another day at Dubai's Expo exhibition, a gathering of 192 countries, which organizers say will carry on till its scheduled end in March, despite a staggering increase in COVID cases on site and across the country. However, new protocols have been introduced as Omicron spreads. Vaccinated staff and volunteers at Expo will have to go through frequent testing following reports of an outbreak.
We've helped them with the sanitization as quickly as possible before they could reopen. So that's something as well that we're trying to ensure that sanitization, which we're doing all the time anyway, but particularly when there is a COVID case, that we really take a very quick action on that.
Visitors are also encouraged to keep masks on at all times, with social distancing adhered to as they enjoy the festivities on site. Meanwhile, daily parades and some other forms of entertainment, which were suspended late December, are now being reintroduced.
We scaled that back. For a while we stopped it completely, and then we've introduced some of it in small groups in different areas. And that was really just to, as I say, a precautionary measure to stop that happening. With all of our events and entertainment team, they are tested every 24 hours. So we are ensuring, and people are working and rehearsing in their bubbles so that, you know, if something happens, we can quickly isolate any cases.
In the past week, UAE has recorded no less than 2,500 new COVID-19 cases daily, up from less than 100 in early December. But this has not deterred Expo visitors.
All the people has their masks on, which is very, feels safe. Yeah, it feels safe. And I feel more comfortable. There's always distancing, social distancing, so it's actually really great, here.
I think it's super neat how they were still able to make this happen. The space that they have, how they're just able to say, oh, we have 9 million people, but yet there hasn't been anything massive, and I think the organization here has been really good too. Just how you have to be vaccinated or have a negative PCR to get in. I think they've really done a really good job about organizing this.
For now, Dubai has no intention of pausing its Expo gathering, already delayed by a year, which has recently completed half of its 6-month run. But as Omicron has shown, it is difficult, if not impossible, to predict what lurks around the corner as the UAE and the world continues to fight a virus that, just like a chameleon, is constantly changing its colors. From Dubai in the United Arab Emirates, Maiwa Diguke for Channels Television News.
And indeed, Maiwa Diguke joins us now from Dubai. Hello, Maiwa. Good to see you. I'd like to start with the Expo 2020. I mean, as an onlooker, it's kind of mixed feelings, but you're there, you're, talking to the tourists. How really are things, seeing as the country as well is also putting some strict restrictions to avoid reduce the spread of the pandemic?
Hi, Millicent. It's good to see you again. So first off, this is now January, the festive season, Christmas, New Year, it's over. A lot of tourists would have gone back, and now the government is doing everything it can to sort of clean up house. And if you remember, the other festive season last year, cases went up to about 4,000. So there's some kind of repercussion for being open, right? But as someone who is here, who's interacting with people, I must tell you that there's a lot of calm and people are being careful, really. But for the expo itself, business goes on as usual. People are, happy to see the event proceed. People are taking precaution, wearing their masks, and there's enough room really for people to just go about their own business. So if you have people who are extra cautious, there's room for them. And if you have people who are a little bit more, say, adventurous, permit me to use that word, there's also room for them. So that's really the situation on ground. There's not that fear or panic that you would expect to see in certain situations. That's not the case.
Let's talk about the travel ban on unvaccinated citizens, I believe from the 10th of January. Is this ban already in effect, and how are citizens reacting?
Well, it is in effect already, and first thing I'd tell you is it's rare to see Emiratis, talk a lot in the open because they're quite conservative. However, what we've seen in local media is some saying thumbs up to that decision. And we've also seen some comments by citizens who say that the government should extend the same courtesy to residents, since the whole idea is to have everyone become protected and extra protected. So some are even saying, just take it further. Let the residents also be given such a courtesy. I would use that word. So that's what we see here. A lot of people say thumbs up. They like the idea and they trust that the government is doing everything it can to ensure their protection.
Remote learning, we both know in 2020 was quite something for a lot of families. And now you have the UAE extending this to some schools, and we also hear no in-person exams till the end of the month. I mean, how are they reacting to this? I mean, are adjustments in place? And if you compare what is happening now to 2020, is this less than what we had when we had the lockdown?
Definitely, it's a lot less than what we had. Honestly, I mean, the vibe that we get here is the worst is over. So all of this is just taking extra precautions. The government has already been telling people and telling the masses over and over again that get vaccinated, get boosted, because studies show that with the booster, hospitalizations are less, and the symptoms are not as severe. So that's what we get here. So for the students, it's not new, right? They did this for many months, and so doing it again, and which is not long term. This is actually a short term plan. So it's less. So no one's panicking. It's become the new normal.
All right, Maiwa Adegoke, our Dubai correspondent. Always a pleasure having you join us.
Thanks for having me.
And an institute in France is predicting coronavirus cases in the country will peak mid-January, followed by a peak in hospitalizations later. It comes days after the World Health Organization warned that half the continent will get the Omicron variant of the coronavirus between 6 to 8 weeks. In the meantime, Saudi Arabia today registered its highest daily number of new COVID infections so far, with about 5,000 cases. Here's more on the global COVID-19 update.
Germany has reported 80,413 new coronavirus infections, the highest recorded in a single day since the pandemic began, as the contagious Omicron variant rips through a population with lower vaccination rates than some other parts of Europe. The previous daily record on November 26 was more than 76,000. French Health Minister Olivier Véran says it's too early to say if the current Omicron-fueled wave of the new coronavirus had peaked in the country, which is currently reporting record numbers of daily new cases. The French health authorities on Tuesday reported 368,149 new coronavirus cases, the highest single-day tally of the pandemic, and the seventh-day moving average of new cases, which smooths out reporting irregularities, rose to a record level of 283,394. Officials in Russia say the country has so far recorded 698 cases of the Omicron coronavirus variant and will prepare new measures by the end of the week to combat its spread. Omicron has pushed COVID-19 cases to record highs in parts of Western Europe and the US, but the variant has been slower to hit Russia, where daily cases have fallen from a peak of 41,335 registered in early November. Morocco says it's considering wage rises for health workers and tax incentives to attract foreign investors and doctors to plug shortages in the health system as it battles the pandemic and expands medical insurance. The health ministry says hospitals have an acute shortage of 32,000 doctors and 65,000 nurses. The Chinese city of Tianjin has started a new round of testing of its 14 million residents. China, which has stuck to what is effectively a zero-COVID policy, is scrambling to prevent the spread of the highly infectious Omicron variant ahead of the Lunar New Year holiday later this month, as Beijing prepares to stage the Winter Olympics from February the 4th. Indonesia today kicked off its COVID-19 booster program for the general public, as the world's fourth most populous nation hit an almost 3-month high in cases amidst the rise of the Omicron variant. The virus has infected more than 4 million Indonesians. And finally, Canada's second most populous province is planning to force adults refusing to get vaccinated to pay a significant amount, not less than $100 Canadian. Quebec has been one of the worst hit Canadian provinces for COVID-19 infections, regularly recording the highest daily count of coronavirus cases of all provinces.
We have more stories on our websites and several breaking news as well. News at your fingertips. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.